to research,
providing same effect as the fish oil,
healthy diets, medical history, and your chance to ask anything.
Funding for this program is provided in part by
Avera is a proud sponsor of On Call on South Dakota Public Television.
and by the South Dakota Foundation for Medical Care, the Medicare Quality Improvement Organization for South Dakota. Additional funding provided by Dakota Care, the Brookings Health System, Regional Health, the South Dakota American College of Physicians, and Swiftel Communications. Closed captioning for On Call is provided by the generous support of Avera, the Brookings Health System, and Fishback Financial Corporation.
there's the valve.
And which was healthier, the yogurt and the bagel?
All right, I'm going to start by measuring the size of it.
You could also add grilled chicken to this recipe.
Blow hard! Blow, blow, blow! Keep pushing.
Push your head.
Pull red handle to open bag.
Hello and welcome to On Call. I'm Tammy Watson. Well, whether you have questions about the medications you take or you're just wondering about a disease that you've recently read about, tonight's show should have answers for you. It's another one of our Ask Anything broadcasts, and we have the doctors live on set ready to answer your healthcare questions. And a little forward promotion. Later in our show, you're going to learn about South Dakota's connection to the doctor who developed the diagnosis of autism, and you'll learn about South Dakota research into the benefits of including flax in your daily diet. But first, let's meet our guests for this evening. With me in the studio are Dr. Matt Bean, Dr. Stu Himmelstein, and the On-Call medical editor, Dr. Rick Holm. They're ready to answer your questions right now. You can call into our toll-free number. It's 1-888-DOCTOR-ON-CALL. Again, that phone number is 1-888-376-6225. Helping to answer the phones and take your questions tonight are volunteers from the Brookings Health System. Dr. Holm, right now, what's the #1 problem in the clinic where you work? It's not exactly cold and flu season.
Hypertension, heart failure, and depression.
Are they worse in the summer, or just that's what you're seeing right now?
I don't know. A lot of my patients who go south for the winter are back, and I get generally their average illnesses. It's not as busy in the summer, but it makes up for it because they're back. There are more of them. Okay. And when they take off in December, January, they lessen, except that people who are left are sicker. So it kind of balances out. I have a kind of...
It's kind of funny because in the wintertime, in Florida where I practice, we say in the winter they're back.
They're back. Yeah, same story. They disappear and then they're here.
Well, that's a good segue. Do our introductions here.
Well, yeah, I am pleased to introduce to you our guest this evening, Dr. Matt Bean from the Avera Medical Group, Brookings, and Dr. Stu Himmelstein from the Quality Medical Association of West Delray, Florida. Welcome. So let's start with you, Matt. We need to know who you are and what kind of work you do and why are you here?
Well, my position at the Brookings Clinic is both a pediatrician and internal medicine physician, so seeing kids and adults. And then I also spend about half my time teaching at the medical school in Sioux Falls.
And a very knowledgeable man you are, and that's why you're included in this show, because this is Ask Anything, and we need to have brilliant answers for these things. Stu, you're from Florida. Now, how in the heck did you get up here? I mean, you're a Floridian doctor, an internist, I know.
Well, I have a good friend, Rick Holm, who kept telling me about this great show, and that it would be good to come up and answer some questions for these nice people. And he wanted me to come up here in February, and it was like leave South Florida in February or leave South Florida in July. So I picked July.
You picked July. I can figure that out. So you're the governor of Florida ACP. What's the ACP?
The Florida chapter of the American College of Physicians, which is the national organization for internal medicine doctors or doctors for adults. Down in Florida, I'm in private general internal medicine practice, and it's a challenge.
Yeah, and he's the governor, and that's how I got to know him. We share that opportunity. Well, this is a great opportunity for you guys to see if you can stump the stars. We've got them here. I bet you can't find something we don't know something about. We'll get your phone going and give us a call. We'll talk about it right after this.
The diagnosis of autism is based on standardized testing plus a clinical evaluation by an autism specialist.
Eating a healthy diet is really one of the best ways to take care of your health, and research taking place right here in South Dakota is offering up valuable insight into the ways that a healthy diet may help prevent colon cancer. A professor at South Dakota State University has identified the value of including flax in our diets, and here's more on that story. Distinguished Professor Chandradhar Dwivedi is both a teacher and a researcher. He's the head of SDSU's Department of Pharmaceutical Science, and he played a key role in a study that identified the potential anti-cancer value of flax. Dwivedi and his research team noticed the similarities in the healthy substances found in both flax and fish oil.
And flax oil provided very similar effect as the fish oil. So I looked at, it's equally good as a fish oil, and at the same time we are helping the economy of our state. So especially this region, North Dakota, South Dakota, and other states, they are major flax producers. So it's providing same effect as the fish oil, but at the same time, it's our product.
Dwivedi and his team found that not only did flaxseed contain healthy omega-3 oil, but also a beneficial compound called lignin.
We looked at flaxseed oil has only omega-3 fatty acids. But when we consume the flax meal, in addition to the omega-3 fatty acids, this has another chemical which is known as lignin, L-I-G-N-A-N. And lignans also have preventive effect.
As researchers worked first with lab rats and then with mice, positive results came back concerning the consumption of flax meal as well as flax oil.
To my surprise and pleasant surprise, when we gave the flax meal to the animals, it produced better effect at lower doses than the flax oil.
Working with ag producers to identify the health benefits of a regionally grown product is one of the driving forces behind Dwivedi's research. But at the same time, he's looking at the big picture and hoping to provide information that can be used to reduce the impact of a very serious disease, colon cancer.
So the colon cancer is the third leading cancer, and especially in the Midwest, people like eating red meat. So consumption of the red meat, which is normally associated with the high fat, so that's one of the risk factors for the colon cancer. And of course there are a number of other factors like age and genetic factors, but the diet is something which can be controlled.
5'8".
Doctors, I want you to follow up on the story we just saw and talk about the value of diet in preventing cancer risks. But first, honestly, do any of you make a point of including flax in your diet?
Ooh.
You do?
Absolutely. 2 tablespoons of flaxseed for breakfast every morning, and then I promote it every time I have a patient who has a colonoscopy. And it's as good as fish oil or better, and it also has fiber for your bowels, and it makes your coat shiny. Well, I've heard that with horses. I'm not sure. What is your take, you guys?
It's certainly one of the things I recommend as a source for omega-3s, but personally I don't imbibe in flax, if you want to call it that.
Right. Stu?
I don't imbibe in flax either. I don't take in a lot of flax myself. It's not the first thing on the top of my list. I think fish oil is still on the top of my list as far as that kind of thing goes.
Okay. All right. So there, we aren't all exactly the same, are we?
Oh.
That's the art.
Okay, fish oil. You live where there's
fish.
Pretty good fish.
Yeah.
What?
Yeah. But it still comes in a little jar at the store.
Oh, that's what you recommend to your patients?
But what do you think? Here's the argument that some people say that fish oil is one thing, fish is better. What do you think of that?
I would probably agree that in its raw form, fish oil is better.
Okay. All right. Matt?
Okay.
Eating a healthy life, eating a healthy diet is more important.
Yeah.
I think as much as we try to make things in nature packageable and easier to consume, we somehow lose something in that process. And I think study after study tends to find that we can't quite replicate nature.
No, and I think most of the multiple vitamin story is just exactly that. You know, we're better off eating fruits and vegetables rather than taking a vitamin.
Okay, I got to ask you guys. Oh, do you want to?
No. I was just going to say that I'm a big advocate during the summer months. Even though we're in Florida, about as far as you can get on the continent away, I still try to get my patients to eat the fresh, wild Alaskan salmon during season.
Oh, there you go. That's it.
We got grocery stores. I wanted to ask you. Okay, you're telling us what we should eat. Is there one food product that you see somebody eating and you just wince? I know you've seen me eat fast food burgers and you make a face because. What else?
Well,
what do you just go, don't eat?
That. I don't mean to be negative about fast food burgers. I think the big problem is too many carbohydrates in our diet. And if I were going to say processed carbohydrates, now I mean, you know, flaxseed has oil and there's carbohydrates in it. But roughage, there's a new data that says that a lot of fiber really reduces death rate. And it was a new article that was just fabulous. But that's some carbohydrate. I think we've got processed carbohydrates that are harmful to us. Now, what do you think?
Increasing fish, chicken, and vegetables in the diet and decreasing all the other stuff is probably one of the healthier things you can do.
Yeah, and so protein is good. But do you agree?
I agree. I think the less we can get away from processed, the more we can get to natural, the better.
Yeah.
Okay. Well, with kids, are there certain foods that are especially important for growth and?
Well, I think trying to get anywhere close to that 5 fruits and vegetables a day would be a goal I'd have for almost any patient, but especially the kids. And that, as simple as it seems, is very tough. When you try and figure out how many fruits and vegetable servings you've had in a day, to get to that goal of 5 is pretty significant. And I think if people could do that, they'd find themselves less hungry for the simple carbohydrates or the other things that aren't so good in the diet.
You know, Matt, that just sort of segged in my mind to when I'm talking to people about who want to lose weight, and I tell them I'm not a diet doctor, you know, but one of the things that you can do is basically maybe a few times a week make a little list of everything that goes in your mouth from the time you wake up to the time you go to sleep, regardless of what it is. And the mere act of doing that makes the person more conscious of what's going in.
And I do that too. I like them to try to figure out how many calories is in it too, because one of the components of a diet that is important to me is portion control. I mean, I think people can eat Twinkies. I mean, Dr. Reitz, you heard me. I said they can even eat Twinkies. Sorry, that was it. But the point is that it's just not that many Twinkies. I mean, if you had a Twinkie a week, who cares? It's, you know, I'm just saying portion control is a big part of it. And if you counted the calories, you'd go, oh my gosh, I'm putting in 3,000 or 4,000 calories when I know 2,000 is a regular.
I overly simplify it and I say, even a really good thing, if you take a boxcar load of it and put it on a laboratory rat, the rat will die.
Yeah. That's it.
Science. Well, I'm going to switch topics. We had a question come in via email already. I'm 70 years old. I take Triam, or generic for diazide, 1 daily, metoprolol
or metopropol.
Okay. Generic for toprol,
beta blocker
for blood pressure. Simvastatin, Zocor for cholesterol, and Celebrex once daily. I'm having trouble with pain in my feet and stiffness. Could any of the medication be the cause?
Okay, gentlemen.
Boy, of the list, I'd have to say the statin, the simvastatin, would probably be one to consider as potentially causing some aching or muscle soreness.
Now, is there 2 statins on that list?
I think the simvastatin is just the generic of what she's taking. Zocor was the brand name. Now it's available generic. And I think the class of medications has its benefits. Now, Dr. Holm, you might disagree. You're not a big fan of statins, but I think it has proven benefit in at least secondary prevention, so people that have had strokes or heart attacks to prevent the next one.
What do statins actually do?
They lower the cholesterol and the lipids. It's just that the diet, we know that there's risks of heart disease and vascular disease from high cholesterol. We just haven't proven, unless you've had a heart attack. If you have not had a heart attack, we haven't proven that lowering that cholesterol changes anything. We know it's a risk factor. We don't know that manipulating it changes anything. It's the same thing with vitamin D. We know that vitamin D is an important risk factor. High levels are good, low levels are bad. We haven't proven that changing those levels.
I'm still a fan of the Framingham study that talks about goals. And getting to goal as far as levels of cholesterol and lipids.
Yeah. And I don't think we in our health society has encouraged lifestyle changes enough. We just go pill. Yeah. Am I wrong?
I think getting back to her question, though, foot pain probably isn't the first place I'd expect the muscle aches to be. Usually it's in bigger muscles, shoulders, hip girdle muscles, things like that from the statin medication. Yeah. So of the list, it could be a cause, but I certainly wouldn't stop it without talking with her physician.
Yeah.
I would probably, I agree that on the list that would be something that would possibly cause those symptoms, but the places and the presentation is not consistent. But what I may have my patients do would be to say, stop taking the statin for 2 or 3 weeks. Give me a call. Let me know if it feels better. If it doesn't, go back on them. If it does, we'll go back on them and see if it reoccurs. If it does, we might try to treat you a different way.
Okay.
There you go.
Now, I know you guys, you can't guess at the cause of the foot pain, but I'm going to do a segue to diabetic neuropathy, because that can cause foot pain, right? Let's talk about diabetes. That's a real big issue.
It's a big issue. It's associated with weight, not always, but it is. And there's complications associated with diabetes, vascular disease, and neurologic disease. One of them is peripheral neuropathy, and foot pain is one of the presenters for this. Comments?
I would agree. I think, probably more diabetes out there than there is diabetic neuropathy, obviously. But of the things I look for in my diabetic patients when they come in, we talk about eye problems, we talk about kidney problems, we talk about foot problems. So I just think it's part of that full care of the diabetic patient.
Do you think that if a person has diabetes, if you can control the diabetes, it prevents the side effects? Matt?
I think that's our goal with it. That's what we're teaching our patients. You try and get to that goal of our hemoglobin A1C of 7, and we're going to prevent some of those long-term complications.
At least the nephropathy, we know that.
Yeah.
When you're presenting with the foot pain originally, I may be behind here, but if you're presenting with originally, maybe that could be the initial presentation of diabetes, but I think there's a lot of other things I would look at first. And if you have the foot pain, well, a simple fasting blood sugar, and for one, a simple fasting blood sugar or 2. But as far as the foot pain goes, you have to look at other reasons for neuropathy, and you have to look at vascular problems too.
So it could be a blood vessel blockage. It could be something in the back and the spine. It could be other causes of neuropathy. Heavy metal poisoning. I mean, there's a million things. You need to go make sure your doctor is aware of this.
Yeah.
Okay. But there's a lot of people who have foot pain, and I mean, I've been not very successful in helping many people with that, except to make sure they don't have thyroid disease and B12 deficiency and diabetes.
Do you get it when you run your half marathons?
I do. I get a little bit of numbness in my feet.
Really?
Yeah.
Does good shoes prevent that? Or?
No, I mean, it's pressure on a nerve somewhere along the back to the toe, that type of thing. Matt, you're a runner. Do you have any neuropathies associated with running?
I have yet to experience that. maybe with time.
Okay, we've got a question from Brookings, 48-year-old female caller. She gets a rash, but it's only in the summer, on her stomach when she's sweating, and she has some creams that help, but she'd like to know what she could do to prevent it in the first place.
That brings a question I always like to ask, and have been wanting to ask a pediatrician and really haven't, and that is, babies have this quote-unquote heat rash. What the heck is heat rash, Matt?
Well, the simple way to think about it is the little glands in our skin. We have glands that produce oil, and we have glands that produce sweat. And the theory behind heat rash is that those little sweat glands get blocked. Yeah. So maybe a baby's laying in a crib on a sheet, and everywhere where that sheet is contacting the skin doesn't allow the sweat to come out, causes a little inflammation in that sweat gland, and you get a heat rash. Yeah. Let the baby cool off, dry off, things usually fade away.
That would be like a person who has skin folds, and in those areas, intertriginous is what it's called, areas, you get some kind of a redness too.
Intertriginous, that's a good one.
Intertriginous. And oftentimes it's manilial.
Well, it's sort of skin against skin, yeah.
Okay. Yeah. How do you handle manilial infections in the intertriginous areas?
That would be yeast infections between the skin folds?
Yeah.
Okay.
Yeah.
Sorry. First of all, I would just try to keep them dry and clean.
Yeah. And I like zinc because it also is a barrier to injury and invasion of the yeast. But oftentimes, you're not going to be successful. So then what do you do? I like monostat and zinc oxide. I mean, and/or
there's a number of mild, antifungal or agents like that.
Yeah.
Can I buy that over-the-counter stuff and give that a try?
Yeah.
Okay. It's over the counter.
Yeah.
Some of the medication prescriptions for the more resistant treatment, you need to go to the pharmacy.
But as far as this woman with the rash in her belly, it could possibly be a similar cause as what we're talking about. Pressure on overheated skin.
Yeah, but maybe her clothing that she wears, the shirts that she wears, is causing that area of her skin where she sweats a lot to just turn into a heat rash. So keeping it less covered, less exposed, or more exposed, I should say, should allow that to maybe not happen as often.
But of course, if it doesn't resolve simply, she should see her doctor.
Okay.
Yeah, that's the final word. I thought also I've seen people who have had topical allergies to, the drying cloth or the particular type of detergent, and so I mean it doesn't bother them when they're dry and fine in the winter. It bothers them when they sweat.
Okay.
So we probably messed that. Well, how do you take care of diaper rash on babies? I do the Manila and zinc. I'm asking the pediatric person.
Leave them open when you can. Can be messy. The other thing would be a combination of zinc oxide or some sort of barrier cream, and maybe combine that with a little bit of an antifungal cream, even an athlete's foot cream, maybe a little bit of a mild steroid like hydrocortisone.
Okay. Those are all OTC.
Treat this nice woman's rash like diaper rash?
Yeah.
It would probably work.
Yeah.
Now, that's going to be messy in her case, but...
She can find out and report back.
Yeah.
Okay, switching gears dramatically, a question from Mitchell, South Dakota, female caller, age 62. What are your thoughts on taking, now correct me on this drug name, Arista for breast cancer? Invista?
I'm not.
Evista.
Evista.
Yeah.
Well, there's also another concurrent one as well, and I'm going to hold off on that answer.
Okay, so really something to talk to your cancer doctor about?
Yeah,
Matt has what I'm thinking of Evista is the selective estrogen receptor modulator.
Right.
Basically, it's blocking estrogen receptors, so they're using it as prevention. Is that the question?
Just for breast cancer, so...
Well, it might be that they're using it as a preventative. If it's not a person who's had breast cancer, because they're off, that's not what we're talking about. But if they're a person who is on Evista to prevent breast cancer, because there's a lot of it in their family, what do you think of that? Stu?
I know that they carry the the data that says that the Evista decreases the risk of breast cancer, but that's sort of a corollary purpose on top of the other intents for that medicine, and to actually use the medicine with that as its primary cause, I think the data is still, a little weak there.
It was designed to be a bone medication to help prevent osteoporosis more than it is designed to be a cancer preventer.
Let me ask the two of you, have you prescribed Evista in any of your patients right now?
Yes.
You have some patient on Evista?
Yeah.
Selective number. I tend to go with the bisphosphonates, a different class of medicines, if they really need it.
Okay.
Okay, caller from Flandreau, female caller, age 72. 2 years ago, she slipped, ruptured a hamstring, had surgery. After surgery, she was still bothered by pain. Is this normal, and is age a factor?
She's how old?
72, female.
So it's unfortunate that
I think it's all possibilities.
Okay, so...
sometimes you do that kind of a major muscle injury, you're going to have tear and injury of nerves that go in that region, and sometimes it just hurts for a long time.
Just scarring of the tendon or muscle where it's healed is not like when it was brand new off the shelf.
What would you do for her, Stu?
Possibly certain kinds of exercises, maybe a heating pad.
PT?
I think some physical therapy may be a benefit.
Yeah.
Okay. A question from Vermilion, gentleman age 68. Is there any long-term side effect by, oh boy, another drug name for me to struggle through. I think it's prednisone. Long-term side effects of...
And what doses, what dose is this person on?
Doesn't say.
Well, we can talk about doses of prednisone. I had a person who I put on prednisone today hoping that it would help her polymyalgia rheumatica, which I'm thinking she has. And I'm going to go 10 milligrams for 2 weeks and then 5 milligrams, and I do not think she's going to have significant long-term side effects with that low of a dose. Comment.
I would agree. I think if you're in that 2.5 to 5, your risks of side effects are probably a lot lower. Just to answer the question in general, are there side effects to the medication? What side effects aren't there to the medication? I mean, you can name a laundry list of side effects of being on long-term steroid medication. So if you had an alternative, you would certainly choose that.
What's it doing in our body when we take prednisone?
Prednisone is a corticosteroid, and that affects your body's own glucocorticoid or your body's own corticosteroid production that your body needs for certain reactions to physiological or stress in the body, not emotional stress like you're having a bad day, but stress in the body system.
Pneumonia.
And a few other things like that. And if you're on chronic steroids, it suppresses your body's natural manufacture of that, so that when your body needs the natural, the natural kick of it because of a medical problem, you might not be able to get that kick, so medically you'd have to substitute that kick. As far as the question goes, like so many medicines, if it's indicated under judicious prescription and monitoring, I think it's a good drug, but it does carry its side effects that you have to be very cautious of when using it chronically.
Okay.
Bingo. Lower doses is relatively safe. I think you nailed it perfectly. But you got to be careful. It's one of the most powerful things and effective things that we need to use sometimes. And short-term bursts are perfectly safe, or almost perfectly safe, if you can say that.
All right, we'll keep on trucking because our show tonight is really an opportunity to touch on all kinds of medical topics as the doctors are showing you. We're going to take a moment to tell you about a man who laid the groundwork for the modern study of autism, a man who has ties to South Dakota. And who better to introduce us to this historical figure than Dr. David Bean, a psychiatrist with the Avera Medical Group University Psychiatry Associates in Sioux Falls. Dr. Bean, you were talking to me previously about a very interesting man in medical history, Leo Kanner. So let's hear a little bit more about who Leo Kanner was.
Well, Leo Kanner was the psychiatrist, the child psychiatrist at Johns Hopkins University, who studied and identified the first group of people called the autistic children. So he is the father of the autistic child syndrome.
What is his South Dakota connection?
The short story is that he was working in Dr. Einthoven's lab. He's the inventor of the electrocardiogram in Berlin, Germany. And a surgeon from Aberdeen, South Dakota came to Berlin to work in Einthoven's lab to learn about electrocardiograph. Now we're talking 1923. Well, Leo Kanner was a Jewish boy who grew up in Austria, and he was a medical student before the First World War, and then got taken into the First World War in the Austrian Army, served in the Austrian Army as a kind of a medical associate, then ended up and finished his medical career in Berlin and was working in Einthoven's lab when the surgeon from Aberdeen came over. They became friends, and the surgeon from Aberdeen said, "Why don't you come to South Dakota?" And so he got a job at Yankton State Hospital in 1924 and was a psychiatrist there for 4 years. Now, during his psychiatric experience there, he was well known as a very kindly, caring physician, and he was presenting at the American Psychiatric Association and meeting in Chicago, and the chairman of psychiatry at Johns Hopkins University heard him and said, "How would you like to come to Baltimore and become our child psychiatrist? There is no such thing, but I'm going to make you a child psychiatrist."
So he is really at the foundation of child psychiatry in the United States.
He is the father of child psychiatry in America, wrote the first textbook of child psychiatry, and then wrote the first paper on the autistic child syndrome in 1924 and became known as the father of autism. And then it became Kanner's syndrome, and then it was the autistic child syndrome. Well, the big issue right now is we have a great movement on autism, and we don't know what it is, we don't know why it is, and it's getting its proper acknowledgement as a serious disorder of children.
Dr. Bean, thank you so much for filling us in on a very interesting piece of significant medical history that has South Dakota ties.
Colon cancer, a malignant tumor of the large intestine, affects both men and women. In the United States, approximately 160,000 new cases of colorectal cancer are diagnosed each year.
Thank you for joining us tonight. We're taking your questions about healthcare topics live, and the topic really is up to you. You can ask anything. Here in the studio, ready to answer your questions, are Dr. Matt Bean, Dr. Stu Himmelstein, and the on-call medical editor, Dr. Rick Holm. Our phone lines are open. You can call in right now. Our phone number is 1-888-376-6225. And we got the questions are stacking up. First one we got here. Doctors, could you please discuss meningitis and meningitis vaccine? Caller from Brookings wants to know.
Matt, that's your baby. Let's hear it.
Kind of a general question. I think probably she's getting at the meningococcal meningitis, which is the one that we get more as older children and adults. There have been some changes recently now in the recommendations. Used to be that we had a vaccine that was only going to last a couple years. People that were traveling overseas would get it. More recently now we have a new meningitis vaccine, and the current recommendation is to consider it at age 11 to 12 years, so pushing it way back into the preteen years.
And then they get a second one?
And they're thinking somewhere around 4 to 5 years it's effective, so probably need a booster because they're going to be most at risk come college time. So when they're living in dorms or a crowded setting is probably when you're most at risk of picking up the disease. So I've certainly been pushing it for the kids going off to college.
Yeah, we have too. You have had a, what did you say about meningitis, meningococcal meningitis earlier?
Well, I was talking about a bloodborne infection with it that they can be deadly. I mean, by the time they present, they can be. It's too late to treat them. So
really, by the time they realize they're sick and their roommate gets them in.
But this is not I'm not talking about meningitis. I'm talking about when the same organism is a bloodborne infection called sepsis.
Okay.
A meningococcal meningitis. I mean, this particular bug.
Meningococemia, which would be an infection of the blood with that organism.
And your cousin?
I had a cousin that died from that. And, you know, as soon as when it presented, it's like they could do everything they could, but it was too late.
Yeah.
Okay. So.
But now there are other meningitises and H. influenza, and let's talk about those.
One that we've almost eliminated completely was the Haemophilus meningitis, so the Hib vaccine that little babies get.
Yeah.
Back in the 80s, started giving that and pretty much wiped Hib meningitis off the map. And we still see it now and then, but certainly much less. The strep pneumoniae bacteria is another one that we now vaccinate kids for with the Prevnar vaccine. So we see very little of that
meningitis
used to see
anymore.
It.
I mean, you know, it's an amazing thing. Healthcare has changed greatly, particularly with the kids, along with the vaccines. I mean, a huge difference.
Okay. Well, this isn't a question on the list, but you're talking about vaccines. Sometimes we get questions about the shingles vaccine. Now, that's not for little kids. That's for grown-ups, right? Tell me about that.
Stu?
Well, that's not necessarily to prevent an infection, but say someone has had chicken pox or an infection with that kind of that family of viruses as somewhere in their past. The virus is harbored in the cell bodies of certain parts of your body, and when your body is under its stress, once again, not emotional stress like, oh, I'm having a bad day, but other stresses like infection or weak from other kinds of things, it can flare up into what's known as zoster or shingles. And granted, that's an unattractive rash to have, but the big uncomfortable thing about that, because the rash will go away, is something called post-herpetic neuralgia, which is a nerve pain, an irritation of that nerve in the distribution of that nerve from where that flare-up was. So if we can prevent the shingles, then we can hopefully prevent the post-herpetic neuralgia. So I advise my patients to get it over 65.
You think it's a good idea?
I think it's a good idea.
Do you think it's a good idea?
I am 62, and I have my wife said, don't say your age. I'm not 65 yet. Some people say 60.
You told me you were 35.
And he said 29 to me.
So, but I haven't had it yet, but I've been telling my patients who are 60 and older to go for it. And if it doesn't completely prevent the shingles, it will ameliorate it or lessen the severity of the illness. And the science is pretty good to say that it's well worth doing it. Sometimes it isn't perfectly covered. It's $250 or something like that. And most insurance covers part of it. And the Medicare covers it pretty good, I think. So are you recommending it for your your patients?
I'm recommending it for my geriatric patients.
And you are?
Offering, I'm not pushing.
Okay.
Okay. A question from Huron, South Dakota. A female age 60 wants to know about antipsychotic medication causes weight gain. Could you suggest a diet that would help? So dealing with the side effect of a medication.
It's a big issue because the people who go on many of the antipsychotic medications, and many of these people really do need that medicine, they have the side effect of some weight gain. And but it doesn't affect everybody. And they can counter it by portion control and an exercise program. Now, I'm throwing it back to you guys.
Well, I mean, the medicine itself isn't causing weight gain. In order to gain weight, you have to take in calories. So it's the medicine causing you to get more hungry or to feel more hungry or to metabolize things a bit differently. So like you said, you can control that to some degree with how much you're eating and how much you're exercising. So I think in that case, they're probably just going to have to be a little bit more careful about those things than someone who's not on the medication.
Yeah. And I like the diet of less carbohydrates and less quantity. Yeah. Stu?
I'm in total agreement there. As far as weight gain goes, regardless of the cause, everyone is not going to be a toothpick, but you can be the healthiest you are if you exercise right and you do portion control.
Bingo, I love that. The best you are. That's good.
All right. A question from Mitchell, South Dakota. What would you suggest for neuropathy caused by chemotherapy? So that's nerve damage or nerve pain due to cancer treatment,
make sure that your oncologist is aware of it.
I think there's a variety of new medications out now for nerve pain. Some old medications used for other conditions now used for nerve pain. It's probably just a bit of trial and error with some of those medications, finds which one works the best. Okay. Unfortunate situation.
Yeah. Once again, I would not assume that it's from the chemotherapy, even though that might be one of the side effects listed with the chemotherapy. I think you need a careful evaluation to make sure you're not missing anything else nutrition-wise or other medical causes before I write it off as that. But then you have the medication to treat the symptoms.
So the major, B12 and thyroid is not toxic from heavy metals and those types of things.
And not with syphilis or anything like that.
No syphilis.
Yeah.
Okay.
I have been checking people for syphilis in this state, right and left, for 30 years, and I've never found a case. They don't seem to get that
Same here. Same with me in Florida. So.
So there you go.
Yeah.
Miracles of modern medicine, right?
Yeah.
Okay. A question from Rapid City. Female caller, age 36. Caller is having a sharp pain, like an electric shock, in the right lower part of her brain every 3 to 4 minutes for the last 3 days. What could cause this, and what should she do?
John?
When I hear of a symptom, when someone tells me I'm having intestine pain or I'm having heart pain or I'm having brain pain, tell me what the symptom is and let's work it up and find out what it really is.
Don't give me the diagnosis.
Yeah.
Okay, so go in.
But,
it's serious not to just assume it's something.
Okay.
But let's say that she's having flashing pains at the base of her head or at the back of her neck.
Could be a lot of different things.
Two things come to mind. Again, I think it needs a full evaluation. I think about nerve impingement pain when she talks about sharp pains that come suddenly, so a nerve getting pinched in the neck. I think about vascular pain, so migraine equivalents or some sort of vascular process going on. But both can be serious, both need to get checked out.
She needs a careful exam.
Okay. All right, a question from Hartford, female caller, age 74. 7 years ago, she had non-Hodgkin's lymphoma. Is there a chance that it could come back, or that it will, the cancer will manifest itself somewhere else? She had 6 months of chemo, or 6 chemos, I'm not sure, and she's in remission now.
7 years ago she had lymphoma?
Correct.
Non-Hodgkin's lymphoma?
Yep. First, what is non-Hodgkin's lymphoma?
It's not Hodgkin's. That's not a funny joke, really. It's named because there's 2 kinds of lymphoma. Well, actually, there's a whole myriad, but there is a certain kind that occurs in young people called Hodgkin's, and then there's all the rest, which is non-Hodgkin's. And then all the rest is a whole variety of different kinds. But I'm going to throw it at my guest. What is it? And
very generally speaking, I would describe it in very general terms as a blood-borne cancer. Like people might have skin cancer, breast cancer, colon cancer. This is a blood-borne cancer of blood cell manufacturing. That can be treated, but of course the treatment sometimes can lead to different kinds of results as well. So once again, she needs a careful evaluation.
Okay.
The farther out she gets, the chances of it being cured are better and better. It's never 100%, but she can certainly feel good having this be 7 years out.
I mean, and you know, maybe she has a different kind of lymphoma. There are certain people who will get the chemotherapy, it cures that problem, and there's another problem, maybe a different kind of lymphoma entirely, a separate illness, or sets you up for a different illness too. So she needs to see the doctor.
Okay. Now with a blood-borne cancer like that, is chemo kind of the only way they're going to be able to treat it? Because radiation in one spot, if the blood's flowing all the way through you.
Yeah. Chemo is not the right word for it anymore because the medicines they have is not so toxic as the word chemo seems. And they've got so much better medication. Well, so, I mean, I really wouldn't be afraid. Just get it checked out.
Shall we just say medical treatment?
Yeah, let's say medical treatment.
Okay. All right, a question from DeSmet.
My hometown. How are you?
Shout out.
Shout out to DeSmet.
What causes dry macular degeneration, and what can you do to prevent it?
Okay. All right.
Cause of dry macular degeneration.
You look at me, Rick.
Yeah.
He's the professor.
I don't think we know exactly what causes it. If we knew, we'd probably have a better treatment for it. There is some support for lutein and some various vitamins that can maybe prevent it to some degree. There's a genetic predisposition that certainly we can't change that part of our history, but I think healthy lifestyle, maybe some of the supplements like lutein have been shown beneficial. There may be some others I'm missing.
Yes. Do any other comments?
No.
I did I did a bunch of research on lutein to try to find out what is the actual data that we have on lutein, and the actual data we have is only when it's already started and gone quite a bit. We've presumed that it prevents, but we don't have the data to say it. It's sort of a lot, like we do a lot in medicine. And I think the major thing you do is you don't smoke, because that definitely is one of the increasing risk factors. And then who knows why? It's aging. Mm-hmm. It's quick. It will be something that if you live long enough, some would say.
There's a lot of those, is it?
Yeah,
right
there is. Yep.
Okay.
Well, the geriatric population today are actually pioneers.
Explain that.
Well, I mean, people are living longer and healthier lives these days, compared to where they were where people were living before. So the elderly people are kind of pioneers with a lot of diseases that they really haven't in so many numbers grown out to this level. So I think it's going to require research.
So not to be impolite, but 40 years ago we'd be dead already, but we're living longer right now. Yeah. Is that?
Yeah.
Okay.
There's no good answer, and it really isn't vitamins and zinc. I mean, the zinc data is pretty crappy too. I think the healthy lifestyle's got to be the most important thing to say. Avoid this smoking, and then know full well that people who have macular degeneration do not lose everything. They still have some vision. It's peripheral, but they still have some vision.
Okay. Somebody from Rapid City wants to kind of pick on us for talking about vitamins. They say you commented that you did not recommend taking additional vitamins, but what about pregnant women? Is this a contradiction? We were just talking about lutein. So
there's no absolutes.
Yeah.
Absolutely?
Absolutely.
That's okay.
The only thing you can be sure of is there's no absolutes.
Yeah. I like D and I like vitamin D, and I'm quick to use B12.
Folate in pregnant women is no question. There should be folate. That's why we supplement a lot of foods with folate, because not a lot of women take prenatal vitamins, or at least don't take them at the point where they're need them.
Pregnant.
Right. Yeah. So, and there's always exceptions, but I think in general, if we eat anywhere close to a varied diet with the supplementation we provide, there's very few instances when we need to have extra vitamins.
They did this woman study, 20,000 women, 5 or 10-year study. I think this is the right number. And they looked at all of the women who were taking a multivitamin, all the women that were not, and there was no difference in groups as far as length of life, morbidity or illnesses. And No difference in groups. I do think there's a difference in the amount of, people who are active. Vitamin D is an issue. And there's, we don't know that it helps it change things, but it's certainly an indicator of risk factors.
Do you have any thoughts on supplements or vitamins?
I have no problem with telling people to take a multivitamin because I'm not sure how balanced a diet they usually are eating.
Yeah, there's a good answer. If you aren't eating, but we push that pill. I mean, it's another pill that we're pushing. I mean, our society is so pill-oriented.
Okay.
But I do agree with you about the vitamin D and the B12.
Good night.
All right. What do you think about taking Metamucil on a regular basis? So somebody would take Metamucil to be regular, right?
There's no harm in it. I just read this article on fiber. It was just changed my thinking. I'm pushing fiber, and it can be soluble or non-soluble. I just like the fiber foods are important, and they decrease your death rate, according to this article. I mean, it was a good article, and it was convincing.
So my bowl of oatmeal every day is good?
It is. Yeah. It is good. I used to say, well, it's got to be, but I think it's the cereal grains that matters more than the soluble fiber. So Matt, did you see that article?
I didn't, no, but I've certainly read multiple articles on the benefits of fiber, and both the soluble and insoluble for lots of reasons. I don't think we get enough of it.
Okay. There you go. And you prove the point with your diet. You eat their oatmeal. Good for you.
I'm going to see if
I'm sitting between two marathon runners. So.
Yeah.
And the rest of us appreciate that. I'm going to toss this one at you. We've just got seconds left. Caller from Colton. Son is in his 20s, had abdominal pain after eating. It's not in a localized area, has had scans and test runs, gallbladder checked. They want to know how to proceed from here and kind of some guidance on going to the doctor now.
Very quickly, you guys. Stu.
I always I have no problem with second opinions.
Okay.
Visit your local primary care provider who's going to take a very good history. I think it all lies in the history and some selective testing after that. But
okay.
I had a patient who had that, and I'm thinking that she had Crohn's disease. I mean, there's a time to do the workup, and it wasn't gallbladder. It sounded like gallbladder. It might be Crohn's. So it could be anything. It needs a careful workup.
Okay. We got about 30 seconds apiece. Got it. Dr. Bean, do you have any final words of wisdom?
I think all things in moderation. A lot of what we talked about tonight is, what amount of this vitamin or that food or this food. I think anytime you start throwing out complete food groups and making things so selective, it gets more and more difficult. So all things in moderation, try to stay active, try to fit in those fruits and vegetables we talked about.
Okay. Dr. Himmelstein?
Live a healthier lifestyle, diet-wise, exercise-wise, and your health and your weight and all that will be just byproducts of that.
Okay. And Dr. Holm?
Not visit Florida in the winter. Are you recommending?
There's too many people there in the winter.
So how much time do I have?
We'll give you 30 seconds.
Well, what a joy to have an internist pediatrician and a marvelous internist from Florida. Thank you for coming all the way to Florida to be on the show. Make your way to South Dakota. Thanks so much, Stu.
Yes.
And thanks, Matt.
Gentlemen, again, like Dr. Holm just said, thanks to all of you. It's been a treat, and thanks for calling in. Stay tuned, though. We'll be right back with the Homespun Perspective and then what's new in medical science.
Looking for reliable healthcare information online? You can start with the resources link at the On-Call website. From there, you can access a variety of accurate and dependable information sources, including the South Dakota State Department of Health and Medline Plus.
It was the trip of a lifetime. Almost 16 years ago, 10 families from all over the U.S. were brought together in a southern Chinese city to adopt baby girls. This summer, 9 of these same families brought our daughters back to see their birth country. This time we started up north near Beijing at a different orphanage and American church-sponsored place for children with special needs. They find donation money for surgery to fix cleft lips, heart defects, tumors, and bony malformations, and then they help these kids get adopted. Our 9 girls, along with 3 sisters and 10 parents, assigned themselves the job of playing with those kids for 2 days in order to give back a little before we started touring. Well, then we journeyed to see the Great Wall Tiananmen Square, the Forbidden City, terracotta soldiers, a panda preserve, and finally, the 3 orphanages from where our children originally came. We were welcomed with a red carpet treatment by orphanage directors and high-level government officials, as no large group such as ours had as yet returned in this way. Well, there are several health-related issues in China about which we can learn, starting with the air and water pollution. There, a clean environment appears less important. Although the economy looks to be booming with big public works construction, the streets are filled with many more cars and motor scooters and fewer bikes than 16 years ago. Cigarette smoke hung everywhere, including restaurants, as many more obviously smoked in China than in the US, and smog was everywhere. Water, not as clean as we are used to, and we used bottled water even to brush our teeth. I return to the American soil appreciating more than ever our clean air, skies, and water. But China has a wonderful tradition worth bringing here. In every square and public gathering place, each morning and evening, even in the steamy heat, we saw people happily exercising, dancing, stretching, and moving, mostly to music. As one young guide told me, especially the elderly realized that the key to staying alive is being active. We in the U.S. would benefit by following that example. Finally, I'd like to emphasize, and I know I speak for our 9 families with China daughters, that the warm, sharing nature and the welcoming culture of the people of China made it the trip of a lifetime. We'll be right back.
In our medical news tonight, cancer drugs and a possible benefit for patients with schizophrenia. Working with mice, researchers at King's College London have identified a particular molecular pathway in the brain, one that is affected by schizophrenia, and they found that a commonly used cancer drug can minimize the symptoms of this serious mental illness. As you may already know, schizophrenia is a severe brain disorder that can cause individuals to hear voices, hallucinate, and become fearful that other people are planning to harm them. Treatment for schizophrenia makes a difference, but it is still a very difficult disease to treat and to live with. Many of the current medications used to treat schizophrenia have strong side effects, so the scientists involved in this most recent study are hopeful their research will lead to options for new types of drugs to treat schizophrenia. In a nutshell, the researchers found that a reduction of an enzyme called P35 in the brains of mice led to symptoms similar to those found in patients with schizophrenia. The enzyme P35 is necessary for the development of a protein that's found more abundantly in healthy brains than in schizophrenic brains. Researchers know that a cancer drug called MS-275 targets the same molecular changes as the enzyme P35, so they gave the cancer drug to the laboratory mice that had the symptoms of schizophrenia, and the schizophrenic symptoms were alleviated. It's hopeful news from the frontiers of science. And that's all the time we have for tonight. Remember, On Call is broadcast on SDPB Digital Channel 2, Mondays at 11 a.m. Central and Wednesdays at 4 p.m. Central. Once more, I'd like to thank our guests, Dr. Matt Bean, Dr. Stu Himmelstein, and the On Call Medical Editor, Dr. Rick Holm. Thanks to our phone volunteers, and thanks to you for watching and calling in. Have a good evening.
Funding for this program is provided in part by
Avera, is a proud sponsor of On Call on South Dakota Public Television.
And by the South Dakota Foundation for Medical Care, the Medicare Quality Improvement Organization for South Dakota. Additional funding provided by Dakota Care, the Brookings Health System, Regional Health, the South Dakota American College of Physicians, and Swiftel Communications. Closed captioning for On Call is provided by the generous support of Avera, the Brookings Health System, and Fishback Financial Corporation.
To learn more about life and health, you can order your copy of The Picture of Health, a beautiful book containing insightful essays and evocative images by on-call medical editor Dr. Rick Holm and Dr. Judith Peterson. This book, containing healthcare advice, stories of medical history, and meditations on healing, can now be yours for $17 at the South Dakota Ag Heritage Museum. Call 1-877-227-0015 to order. This offer is made by Ag Bio Communications at South Dakota State University.